After seemingly endless bad news about COVID, there could finally be some green shoots of optimism appearing. The number of new COVID-19 infections is falling and a vaccine could start to be rolled out before the end of the year. So when could life start to return to something like normality? Well, joining us from Liverpool is Professor Calum Semple, who sits on the Government Scientific Advisory Group, SAGE. Thank you very much for being with us. The Prime Minister set to announce tomorrow that people will be able to meet their loved ones over the Christmas period. Is allowing household mixing at Christmas a good idea?
Well, in reality, we cannot ban Christmas. And to do so would just lead to breaches and what are you going to do about that? So instead, what we're looking at is getting R, if you like, down, but also getting the absolute numbers of cases down. And there's real good news here. Nationally, we're seeing cases in the community fall, and in those areas that went into Tier 3 before lockdown, we're already seeing the tide turning with the number of hospital admissions, and we'll shortly see deaths reduce as well. So there's every reason to believe that when lockdown is lifted, many areas will be able to go into lower tiers, but some areas will remain in higher tiers. Then you've got this period in the run up to Christmas, and hopefully, if the system works, we'll be able to relax some regulations for a few days. But there will be a price for that.
You say there'll be a price for it, and Public Health England said that for every day that restrictions are relaxed, we could see 5 days of tighter restrictions as a result. Is that assessment broadly right, do you think?
Yeah, I think in the round it's right, but it shouldn't be seen that it's going to be draconian restrictions. It's just going to prolong restrictions and a higher level of restriction for some areas and perhaps all areas as a whole. It's very hard to know because we're talking about human behaviour here. We know that restrictions work. We also know that we need to open up the economy. So there's a very difficult balancing act here. And the vaccine won't come soon enough for the general population. And it's within the general population that most household contacts take place, most personal care contacts take place. And it's these intimate interactions, prolonged personal interactions that drive that are back up again.
Interesting that you're saying that the vaccine rollout won't happen in the mass population for some time yet. When do you think we could start to see the return to normality that people are hoping for?
The vaccine priorities will inevitably be the most vulnerable and the frontline healthcare workers. It won't be academics like me. And I think we'll be seeing that phased out in around Christmas and New Year because the vaccine's already ordered and we've got excellent results. For the rest of the population, I think we'll be looking towards the summer before there's mass vaccination of the rest of the population. And that's what will give us the immunity, the broad immunity that allows us to return to normal. But having said that, there's still going to be vulnerable people where we will need to take care. And in general, this has taught us what the importance of hand washing and good PPE that we need in our care homes and our hospitals. I mean, we've had rotavirus, norovirus, MRSA. There's lots of other things out there. So we do need to learn from this and improve our general infection prevention control measures.
So if you say that the majority of the population might not be vaccinated until the summer, do you think we're facing social distancing until next summer, realistically?
I doubt that, because if we can vaccinate the frail and the elderly, then that will take the pressure off the groups that will be coming into hospital with severe disease. We do still have a core of particularly women aged between 20 and 50, 20 and 40 particularly, where we're seeing 3 or 4 times more admissions of these women than men. And that's really not been well explained, but it does seem to match their roles in hospitality, healthcare, entertainment industry. And many of them are going on to have long COVID. So there will be a strong push to get the vaccination throughout the community and not just focus on the elderly. But the elderly and the frail people and those with medical conditions will come first. But I do think we will be seeing lifting of the restrictions in the spring, and I think there's a lot to be optimistic about here. We've also got a really good ways of looking after people now. So death rates in hospital have fallen from 1 in 3 to 1 in 6. So there's lots to be optimistic about here.
Lovely to get a bit of optimistic news in these interviews. Normally it's just been kind of doom and gloom, so it is nice to have a sliver of hope as well. I was quite struck by what you were saying about younger women or women between sort of 20 and 40 catching COVID, perhaps because of their role in hospitality industry. And I just wonder what that means for the general restrictions that we're likely to enter into from the 2nd of December, because we've been told that there'll be a strengthened tier system for England, perhaps an acknowledgement that the one before wasn't quite tight enough. What do you think that strengthened tier system needs to look like? Do pubs and restaurants, for example, need to close? Do we need to be much more tighter on household mixing?
I'm going to be really difficult here. What we as advisors do is provide best evidence, and there's some really good evidence here about exactly which sectors are responsible, if you like, for transmission. We know a lot more about the roles of cinemas, hospitality, food production, warehouses, health and social care, and in fact, right down to the levels of nail salons, beauty parlours, barbers, ladies' hairdressers, and tattoo parlours. So all that information is now in the mix, and we know we can tell that with really good accuracy. That information gets passed to ministers, and they will decide. And you won't be surprised that I'm not going to prejudice the or be seen to be lobbying one way or the other, or contradicting what difficult decisions are going to be made today.
Yeah, I absolutely understand the difficulties, shall we say, in being a sage advisor and making sure you don't want to break any confidences or also talk about decisions that are ultimately political. Could you give us a bit of a steer on what the data does show about where the higher risk areas of transmission are?
Yeah, there's some real surprises in here. Construction industry, you'd have thought working outside wouldn't be a risk, but many people in construction are actually working inside before buildings are made essentially COVID safe. So construction industry has turned out to be a risk that I was surprised to see. But other areas are exactly as you predict. High risk around food production, whereas indoors, poorly ventilated, kept quite cold, so you don't have high airflows and workers working very closely together. The other ones are quite obvious, but you can't do much about them. I mean, health and social care is such a key part of society. We know that it's associated with exposure and risk, but we can't shut that down. We're not going to close health and social care down when we come out of shutdown. So that's why it's such a difficult decision to make. We essentially have so much more information now, and we can target exactly what areas are responsible. We do know that pubs, clubs, social clubs, cinemas are associated with transmission, and there's no easy way out of saying that they are problem areas. And whereas in the summer we could use the beer gardens and drink outside, we don't have that liberty now.
Yeah, a bit chilly to do that now, certainly. Some of the industries that you mentioned, hairdressers, for example, pubs, have taken quite a lot of COVID precautions with the use of face masks or trying to socially distance where possible. Has that made any difference, according to the data?
I think, according to the data, we can still identify these as very high-risk activities. On an individual basis, there will be people that have adhered strongly to using these mechanisms of protection, and that will have protected them. But as in all things, the underlying activity is risky, and it doesn't take much. You just touch your mask when you shouldn't have, then you pick up the scissors and you adjust the hair, or you wipe something out of somebody's eye, and all of a sudden you've broken the barriers. So it's not just a case of, oh, just bang on a mask and a visor. It's about not touching the face mask. It's about washing your hands. And it's difficult. It takes nurses and doctors years to learn how to do this properly. And it's very, very difficult if you're a member of the public to get into the swing of using PPE effectively.
There's a lot of speculation that the 10 p.m. curfew could be scrapped or at least adapted so that last orders are at 10 p.m. but you've got an hour to finish drinking up. Do you think that would make any difference to transmission?
Okay, so one of the features here is that history has got a lot to teach us. And in the years of prohibition, they tried to change the drinking hours. They tried to say you could only drink if you had a meal. And everyone's very inventive and finds ways around it. So I think fiddling at the edges of something like drinking up times and pubs closing times is simply not an effective mechanism. I think with pubs and clubs, you have to look at the whole human behaviour and take human behaviour into account. And I think that was what was missing when this first came in. I think whatever iteration you see next will be better informed by understanding human behaviour and not driving us into an unintended consequence that can increase transmission, such as closing the pubs early and everyone turfing out onto the streets at once. I think that's one of the lessons we've learned, and history has got lots to teach us here.
Yeah, we all remember those pictures of everyone piling out onto the street after closing time. Thank you so much for coming on the programme. It's been really fascinating to talk through some of that data with you. Thank you.